Good morning and welcome to Look and Feel Your Best. This is a show where we will give you some great information on how to look your best and in turn feel your best. Dr. Patrick Flaharty is the medical director of the Azul Cosmetic Surgery and
Medical Spa.
Thank you. I was going to say that.
That's okay. It's a mouthful.
Yeah, and he's running the show and I'm just here helping out. I'm Gina Birch. and stumbling over the name of the place, which you've got actually 3 locations in Southwest Florida.
We do, yeah. We have an office in North Naples, right on Immokalee and 41. We have one in Bonita, which is right at Coconut Road and 41. Mm-hmm. And then one in South Fort Myers, right here on Daniels Avenue, right by Cross Creek.
That's awesome. Yeah. And I'm going to go ahead and throw the website in, azulbeauty.com. And if you can, during the breaks, you can jump on there and look at maybe find some of the information we're talking about or photos. I love looking at the photos.
Yeah, azulbeauty.com, our website, has got a ton of information, so there's a lot of good stuff on there. So anything you might hear that you say, gee, that's interesting, I want to know more, you can find more on that site.
Right. And here at the Azul Cosmetic Surgery and Medical Spa, Dr. Flaharty does a little bit of everything. We're talking about the non-invasive, the skin care, all the way up to full facelifts and all kinds of surgical procedures. So it really covers the gamut, everything that you do.
Yeah, and really it's a team of people. Obviously I'm the medical director, but we do have 7 providers, 6 others besides me. We have 2 nurse practitioners, a physician assistant, and 3 estheticians. And so we offer a number of services, and it's, as we'll talk about today, there's just so much that can be done. I love the concept of what we call the pyramid of rejuvenation, which is a framework which I use for a lot of lectures to the public on what we do in facial rejuvenation and even in body rejuvenation, what are the options. And the idea behind that pyramid is there's 3 layers of the pyramid. The bottom layer is called non-invasive, and that's basically anything we do that's non-invasive. No puncturing of the skin, no cutting, no stitching, just things that we can do completely non-invasively. And it sounds funny because you think, well, what can you possibly do that? You can't do Botox, you can't do fillers, you can't do surgery, but there's a lot you can do.
So much.
Yeah, and we'll talk about some of the popular techniques in that arena. And then the middle of the pyramid is minimally invasive, and that would include all the injectables, Botox, fillers, Sculptra, as well as, some new technologies like Instalift, which is a new suture lifting technique that's been very popular. And
similar to the old threading back in the day.
Similar. It's made some improvements over the older threading techniques with the suture, most importantly, being absorbable, which is nice because, and as the suture absorbs, it creates collagen. So it's kind of like Sculptra and a lifting procedure together because it'll build collagen while it tightens and lifts the tissue.
Great.
So we'll talk about that. And then obviously the apex of the pyramid is surgical procedures, and they continue to grow and evolve. I spend about half my time in the OR doing surgical procedures, brow lifts, lids, facelifts, neck lifts, laser resurfacing, fat augmentation, replacing volume. And those procedures continue to gain in popularity as well. But when you look at the pyramid, it all makes sense geographically because the apex of the pyramid is the smallest portion. So obviously the number of procedures we do in the surgical realm is relatively small compared to the number of hydrofacials we do in the office or other techniques like Coolsculpting techniques. So the pyramid concept makes sense, the base being non-invasive, things that you can do quick and easy with little or no downtime. And generally those are things that are typically less expensive too, so they appeal to a wider audience,
Right.
And then the minimally invasive, obviously you can deal with, in injectable world, there can be a little bit of downtime. It's fairly minimal for most of these injectables, like little or no downtime, but they are injections, so sometimes you can have a little redness, swelling, or sometimes some temporary bruising, but usually with those things, you can use makeup right away. And obviously the apex of the pyramid, the surgical procedures, still have their place. One of the questions is, oh, wow, is surgery just going to go away because we've got all these great new techniques? And the answer today is a definitive no, because there are just certain things we can't do without surgery. And, although we do have some really exciting new technologies that perhaps are giving us results that are, in some ways kind of getting closer to surgical results, in many of the things we do, we just don't have have options that are non-surgical that can do that. So, for example, Coolsculpting. If somebody's got fullness in their anterior neck, just extra fat there. In the past, we'd probably do a neck liposuction, maybe a face and neck lift. You could do Coolsculpting there, which is completely non-invasive, no injections in the office, and you can eliminate some of that extra fat.
Just shrinks it away, gets rid of it.
Away. So that would be an example of where new technology is making something that was only a surgical available option, a non-surgical option. But in a lot of other areas, for example, heavy upper eye, we don't have a non-surgical option for that. You really, when you get extra skin, that needs to be trimmed out. And severe laxity of the lower face and neck, significant aging of the lower face and neck. I mean, the technologies we have to try to tighten the lower face and neck, like Ultherapy and Infini and Thermage, and these techniques just don't work that well. They're not rivaling what we can do with the facelift. So, we embrace.
But they can buy you some time.
Well, yeah, and we embrace technology,
right.
as you know, Gina. We have every every tool in the box here, but and it's great, and I love that. And our providers are really keen on trying to be progressive and create the latest and greatest treatments. And that's how you learn, that's how you grow, that's how we make things better. But at the same time, I don't feel threatened that like my surgical volume's going to go away. It gets more.
Right.
It gets to be more every year. It's just a matter of finding the time to do the procedures, because the results we get with surgery are just in most cases superior to non-surgical options. Obviously longer lasting, but they are more expensive. They do take a little bit of longer time. A week or two of downtime, which not everybody has, or at least not all the time. And so there are a few little bit more hurdles when it comes to, okay, I want the surgical result, but can I schedule that time off? Can I get it done?
Sure.
So, that's kind of where the pyramid shakes out. And so it's kind of something we, kind of live in that pyramid every day as we, talk with patients and do consultations and look at, their problem areas and what they want to address, and then what's the best way to do it, and try to come up with a plan that's unique for, their circumstances.
Sure.
Yeah.
And when you look at that base of the pyramid, and the whole thing we're trying to do here is to look younger and turn back the hands of time. And there are really some very simple things that a lot of people overlook. I think more and more we're getting the word out to take care of your skin, but it's just skincare. I mean, that's so basic. Washing, moisturizing, and there's so many great peptides and growth factors and all these things that you can put on your skin that can really lighten and brighten and make it a huge difference in the appearance.
Yeah. Skincare is often overlooked, and I have to admit that even I overlooked it for many years. I think when you're a young surgeon, you just want to do surgery, and anything that was non-surgical, I was sort of less interested in the early days. Now now that I need skincare, now the motives have changed, right? So, and I think my awareness has increased over the years of developing these Azul platform and the medical spa, and having really good estheticians who show you how well skincare can help the skin. And it is pretty remarkable. I saw a woman yesterday for a facelift consultation, and she had the most amazing skin, and we talked about it, and she just has very diligently stayed with really active skincare, mainly just topical products, but her skin looked amazing. Her skin looked, she was ready for a lower face and neck lift because she had some laxity, but the skin looks great, and everything we do works better when the skin is in good shape. So, I love to see that, because that part of the equation, she's got it going, and that makes our job easier.
Definitely, whether it's a surgery or Botox and that type of thing, when your skin, when the outside of the canvas looks better and is healthy, it'll heal better, and just everything works better.
Right.
The other thing I was going to say about that, you're never too old to start. So if you're listening right now and you're thinking, oh, I'm 50, 60, 70, whatever, how can a topical help my skin?
Yeah, people will be be amazed. They'd be amazed. So we'll talk about some of the techniques we use, like hydrofacial and the microchanneling with growth factor and the BBL. We'll get into a little more of that in the next segment. But, that's an important point to make to the general public is you may think, okay, well, I'm looking older, but, for whatever reason, I really am not a candidate for surgery or don't want to do surgery. So therefore, forget it. There's nothing really I can do, which isn't true. I mean, if you address your skin and get that reconditioned and in good shape, it will make you look tremendously better. It can make a huge difference in your appearance, and that's easy to do in the office, no downtime, and minimal to no discomfort, depending on the treatment protocols. But most of them are obviously very well tolerated.
And the products that you have here, and a lot of people I know say, "Gosh, I go to Walgreens, not to name drop, or Macy's or wherever the makeup counter, and I just look at all this stuff, and I'm like, where do I start?"
Right.
Well, a good place to start would be to come someplace like here, because the quality. You have somebody guiding you to pick the right things for your skin.
Yeah, I think guided is the key there, because every skin is different, and to some extent it's a little bit of trial and error. But looking at the skin type can help get you started on the right path, and that makes a big difference. And Azul SkinHealth is our other website, which is linked to the Azul Beauty, and that has all of our skincare products and has a basic little 5-question questionnaire that helps direct you in the right way for skincare products. So even if somebody just says, "Gee, I'd like to try some things," you could go to the Azul SkinHealth website, answer those questions, and it'll direct you accordingly based on your skin. Yeah.
And there is a link on azulbeauty.com as well if somebody can't remember Azul Health.
Right.
Yeah.
Yeah, that's correct.
Okay.
Yeah.
All right. Well, we're going to take a quick break here, and we're going to dig a little deeper into some of the things that Dr. Flaharty had kind of teased us about on the bottom of this pyramid of ways that are non-invasive techniques to help us look younger. You're listening to Look and Feel Your Best, and we'll be right back with more. Welcome back to more of Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch again. Dr. Flaharty is a medical director of the Azul Cosmetic Surgery and Medical Spas in Fort Myers, Naples, and Bonita Springs. And this morning, we are talking about the pyramid of rejuvenation. And if you've ever been to one of Dr. Flaharty's seminars, this is something that he draws upon a lot. And it really makes sense when you look at all of the options out there when it comes to facial rejuvenation. And the bottom of the pyramid, where we're starting, is the non-surgical, and that segment of your business has grown by leaps and bounds over the last decade, hasn't it?
Yeah, I mean, if you look nationwide, the fastest growing categories are the non-invasive, which is the base of the pyramid, and minimally invasive, which is the middle of the pyramid. And surgical procedures are growing. From time to time you'll have a year where it's flat, where the number of surgical procedures is flat, but in the last few years it's grown a little bit. But the rate of growth in the surgical procedures is slower. For certain, the non-invasive categories have been growing at like 14% a year, which is really a pretty fast growth rate. Yeah, because again, as we talked about, these things are easier to do, more affordable, no downtime, so they appeal to a larger group of people. So for people who have maybe never been interested in cosmetic anything, and all of a sudden they start thinking about things like skincare or Botox or fillers, and find that these things can be done, they're quick and easy and very effective and can make a difference, then that's where we're seeing the growth.
Okay.
Yeah.
And we talked a little bit during the introduction, our last segment, about skincare, and that's just so basic and so easy to do. And you can get guidance here. But one of the other big things, the big areas have been in lasers and laser-like equipment to change the condition and appearance of the skin.
Yeah. So what can we do with the skin? So with skincare, there's lots that we can do. And, it used to be in the early days, we'd bought a microdermabrasion unit and everybody got microdermabrasions, and that was a nice technology, and it was especially good for people who hadn't been doing skincare and maybe were a little older and had a lot of dry, scaly skin to get rid of the dead cells and stimulate new collagen. Boy, have we come a long way since then. So, a general kind of a cleansing instrument is the hydrofacial, which is great technology that exfoliates, cleans, and then infuses the skin with whatever active you want, depending on what type of skin.
Like a growth factor or
hyaluronic acid for moisture, or if it's a teen who's got acne, we will use salicylic acid to try to break up the clogged pores and get the skin breathing again. It does a deep cleaning by suctioning out then these pores and kind of cleaning the skin, and then you can finish with some type of topical like a growth factor with a moisturizer or hyaluronic acid. So it's a fantastic treatment that takes about 30 minutes and does all those things: exfoliates, cleans, infuses, hydrates, and rejuvenates the skin. So that's our cornerstone. I mean, it's such a great treatment, and our estheticians love it and our patients love it. But there's we can move kind of up the line a little bit in terms of efficacy in terms of skincare. So what about browns and reds? And that's something we see a lot of: sunspots and red spots from dilated capillaries or broken capillaries on the skin. And now we have non-surgical ways to treat those, and that's called the BBL, broadband light. So it's a flash of light energy that's absorbed by the pigment. It'll turn the sunspots coffee ground dark. They'll work their way to the surface, and then they just sort of flake off. That may take a week or two, so they can look worse before they look better. And with the vessels, the energy is absorbed by the hemoglobin, and it actually just shuts down the vessels, so those kind of disappear right away. You see an improvement. And usually with somebody who has never done one, who may have some sun damage, mild to moderate sun damage, we do a series of 3, and that cleans up a lot of the reds and browns and makes the skin just look better. We also see patients who are doing this kind of on a regular basis annually for a number of years, that it does shrink pores, helps tighten the skin, reduce fine lines and wrinkles. And
so it has a lot of benefits.
It makes the skin look better. Yeah. So we used to think just reds and browns, but then we started looking at the photos of people who've been on this. And of course, if they're doing that, they're probably using topical products, and those have gotten better. And so you see really nice improvements. And again, these are, non-invasive, When you see the result of a BBL, a series of BBLs, and you think about that's completely non-invasive. You haven't injected them with local anesthetic, or they haven't had to put Vaseline on for recovery. Nothing. It's pretty amazing.
And what's cool about that as well is, so you've got this beautiful, nice face, and then you go down to the décolleté in your chest, and you've got all those brown spots again. But this is a piece of equipment that can be used on your neck, your chest as well.
Right. You can see that a lot because there's certain things we can do with the face, like more ablative resurfacing, which is really when we get to that level, which is more surgical, is for wrinkles and more severe sun damage, because we don't have great non-invasive tools for wrinkles, but we do for pigmentation, the reds and browns. But you're right. So BBL we can use for the neck, the chest, as well as the hands and arms, and even the legs, because you get sunspots there too.
Oh yeah, the hands and arms. Right. I'm looking at mine now, and it seems like every week I'm like, where'd that? There's another one.
Yeah, no kidding. And so it's a great tool for blending in, especially blending the face into the neck and chest and trying to clean up some of that sun damage, and also the arms, which can be a disconnect if the face looks great and the hands are lots of brown spots. And
does it help with the crepiness on the arms as well?
Not so much with the crepiness. There are other technologies like the Infini for tightening, and on the hands we are using a lot of fillers to fill in because there's fat loss from the hands, and that makes the skin a little bit more loose or look a little bony. So we have some other techniques for the décolleté and for the hands to try to rejuvenate. But the BBL is a cornerstone because eliminating the pigment and getting some of that skin tightening really makes a difference. dose, and then you can add a couple of other elements like fillers to that regimen.
Layer down there.
Right.
Micro-channeling is another hot topic right now, and something that you've been doing a lot of. I was just watching some TV show like Extra or Hollywood, one of those where they were going in to see what the stars were doing to make themselves look better. And I've seen that several times in the last few months, them talking about micro-needling and micro-channeling.
Yeah, micro-channeling is great. So micro-needling is sort of a global concept that's been popular for a few years, and that's using small little needles puncturing the skin, which will stimulate your skin to heal itself, and that process creates new collagen. And so we know, kind of there is this sort of idea that you create a certain injury that stimulates your body to heal, and that creates this rejuvenation. And so that was the concept. And so we know it works, but some of the early instruments were pretty rough in the sense that you'd look worse before you'd look better. You could do this treatment, but you could have some redness, swelling, even some punctate bleeding, and then, the skin might not look so great for a few days, anyway, depending on how aggressive you were, anyway, from a couple of days to maybe even up to 5 days. And, in my mind, it's nice to have a treatment that gives you good short-term results as well as good long-term results, because, again, if you have 3 or 5 days where the skin doesn't look good, that's kind of downtime.
Yeah, it is.
So the microchanneling was technology developed by a dermatologist that is a better instrument that reduces drag. So it does make small little micropunctures. You can control the depth, so you can do it much more superficially, which for most people is appropriate. Some people with bad acne scarring, we want to be aggressive because we're trying to build new collagen throughout the layers of the skin. And, so that's a different treatment when you're going after that versus somebody with just mild skin aging with some laxity and wrinkles. The adjustability of it and the precision of the actual needling apparatus is so much better that patients generally look really good right after the treatment. And we add to this a growth factor serum that has 5 different growth factors. And so you're making these small micropunctures at stimulating your body to heal, but then you're infusing the skin with these growth factors. And as you can imagine, now that you've made these little punctures, there's access for these growth factors to get into the skin, not just, they don't have to go through the whole layers, they can actually go through these little punctures. And so you're infusing the deeper layers of the skin with these growth factors, which will stimulate collagen. And then you can finish with something like hyaluronic acid, which is just a protein that's highly attractive of water and can plump the skin. So it's really a great moisturizer and plumper, so that when you're finished, the skin will be a little red and a little puffy, but smooth and plump and look really pretty and look really healthy. And so that's, again, the win-win. You get the nice short-term result as well as a good long-term result without having this this several-day period of downtime where the skin might look a little beat up. That's, again, the higher level of sophistication, trying to get good short-term and long-term results.
In the intro or last segment, you briefly touched on Coolsculpting and how that can also help the neck.
Right.
A lot of people have a heavy neck, and they're thin everywhere else, but you look up there and they just have this pocket of fat under their, their chin.
So, when we break our services down into the pyramid, Coolsculpting falls into non-invasive. So you think about that. It's permanent fat reduction like liposuction, but without surgery. No anesthesia, no injections, no stitching, no cutting at all. It's just using cold technology to freeze fat cells to the point where some of them will just die and just sort of fall apart and be resorbed by your system. And that's what happens with this. And so the Coolsculpting apparatus is designed to treat, external areas of excessive fat, lower abdomen, upper abdomen, your inner thighs, love handles, inner thighs. Yeah. If you used to say, if you can squeeze it, you can freeze it.
I can squeeze a lot of areas.
So but I love that one because it's very accurate. And so for any of these problem areas, bra fat up where our arm and breasts come together, sometimes you get extra fullness there, or back fat where, you might have these rolls like halfway down your back that occur with age, so all these areas, it's really a body sculpting technique because it can selectively shrink down these areas and contour your body, and it works. It works. It's fantastic. It's a great technology. It really works, and it's easy to do. And you're out doing normal activities the next day, no downtime, which is great.
That's amazing. And you keep getting different applications for different parts of the body all the time. It's just evolving and growing and improving all the time.
It is. It keeps getting better and better. So it's really been a great technology. Yeah.
All right, we're going to take another quick break here. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch, and when we come back, we will talk about some minimally invasive techniques on the Pyramid of Rejuvenation. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty, Medical Director of the Azul Cosmetic Surgery and Medical Spas. I'm Gina Birch. We're talking about the Pyramid of Rejuvenation when it comes to turning back the hands of time and making you look younger and feel younger. Of course, facial. We did talk a little bit about body contouring and Coolsculpting.
Sure. Yeah.
And how some of like the BBL can be used on other parts of the body. But generally, we're addressing the concerns of the face today.
Sure, yeah. A lot of it we're focusing on is the face.
Right. So we started with the base of the pyramid. Things you can do are non-invasive things like the skincare and some of the lasers and micro channeling and Coolsculpting. But now we're moving up a little bit to another area that's this part of the pyramid might be bulging a little, getting a little fatter, right?
Yeah,
because
right.
You're doing more and more of things like Botox and fillers.
Right. So the middle of the pyramid is the minimally invasive procedures. So we just talked about non-invasive procedures like skincare, including hydrofacial, BBL, microchanneling with growth factor, and Coolsculpting. But the minimally invasive category includes what we call the Azul liquid facelift, which is using a combination of Botox products, Botox, Dysport, and fillers to rejuvenate the face. And that's been an extremely popular area of growth in our field over the last 10 years. Because I think as we started playing with these products, really over the last 20 years, we recognized that so much of facial aging is a result of volume loss. Mm-hmm. As we age, we lose fat from our face, and our faces become thinner. We also lose bone. Our bones kind of remodel. And so naturally, we get this deflation where we start as, you look at teenagers and young adults with these plump, full faces. And then as they age, those faces tend to thin. And in the older ages, they can look quite gaunt and deflated. Mm-hmm. And so a lot of, aging is volume loss. And for many, many years, we really didn't address that because we didn't really have tools to address it. We basically would just, if the skin was loose, you'd tighten it with a brow lift or eyelids or facelift, but you weren't really restoring lost volume. And you've seen plenty of people and pictures of people who've gotten tight skin but very thin faces.
Right.
Which don't look great, they may look somewhat better.
Windblown.
Yeah, windblown.
They look.
They still look hollow, and and health is kind of the thing, looking healthy, which I always, when we talk to patients about fat augmentation, which is a more surgical, long-lasting correction of volume loss, using your own natural fat to restore that lost volume. That really, the purpose of that is to make you look healthier. It makes you softer and healthier.
Yeah, fat's a funny thing, isn't it? Too much is not good, and too little is not good either. You just got to have that happy medium part where it's perfect, and we fight for that our whole lives on one end or the other.
Yeah, you're right. It's elusive. People pay us to remove fat from the body, and they pay us to put fat in the face, right? So that's how it goes. It's life isn't fair that way.
No, well, in many ways, but at least this is one we can correct.
Yes, right. But minimally invasive, the liquid facelift is really powerful. So how did it all start? Well, way back in the 90s, and even before, with the advent of Botox, it was noted that, if you put Botox between your eyebrows, then those little frown lines sort of disappear for 3 or 4 months, and that actually makes you look better. And if you put it around your eyes, and the crow's feet soften for a number of months, and from there it just built and built. So you can use it in the forehead for horizontal lines, and you can use it delicately in the upper lip for the vertical vertical lip lines or to lift the corner of the mouth. We also use it for neck bands as well as to shrink the masseter muscles, which can give us a little, especially women, sort of a boxy face where, too full, kind of chipmunk cheeks. You can shrink those muscles with some Botox to give them a little bit more of a tapered, feminine face. So there's sort of an unlimited number of uses for Botox. And then the modern fillers came. The original fillers, which were bovine collagen, which was approved by the FDA in 1983, was a very watery collagen product that really didn't work very well. It might just give you a little bit of volume for a few weeks, but it just wasn't very strong, and so it would just sort of disappear pretty quick. But it was still popular, especially amongst the Hollywood set, because you could, have your lips done and look good for, the Academy Awards, right? For that night, and within a couple of weeks it would be gone. So it was kind of like special event type of a product. But now we have, this incredible sophistication of fillers where we have, a lot of FDA approved fillers, and they're made, most of them are made of hyaluronic acid, which is important because that's a natural protein that attracts and retains water. So it's sort of the perfect kind of substance for volumizing the face. You can use it right in the skin or right down to the bone or anywhere in between, and it's made with different densities and different kind of formulations to create different physical properties. So if we're trying to lift the cheeks, for example, we want something that's a little bit thicker and firmer. If we're trying to augment the lips, we want something soft and natural for the lips. If we want it to swell to give us more volume, like in the cheek or temple, that's okay. But under the eyes, we don't want it to swell because that could create bags or make the eyes look, go from a dark circle, hollow eye to one that's overly full or looks, where you have swelling there. So the physical properties have been kind of exploited to give you the best result, and we'll often use 2 or 3 different fillers in a face to correct the volume. Some for volumizing, lifting the cheeks, filling in the temples, taking away that sort of hollow, gaunt appearance, and others just for the delicate areas like gentle reestablishing some of the volume in the lips, filling in dark circles under your eyes, filling in fine lines and creases around the mouth. Very popular area with fillers, which can nicely soften and reduce a lot of the lines and creases we see. And if you combine that with the Botox, then you have this really powerful treatment where you're eliminating lines, creases, and hollows and dark circles on the whole face. And, it is appropriate to call it a liquid facelift because you can get a really dramatic rejuvenation of the entire face just with injections. And these are done right in the office, just with topical anesthesia. So you put a little cream on that numbs the skin, you do the injections, and you see the results immediately.
That's the cool thing about this is, like you said, there is very little downtime. There's no downtime. I mean, you might be a little red at a couple of places where you've had an injection, but I mean, those fillers, it's immediate. Yeah,
with the fillers, you see it immediately. With Botox, it takes a couple of days to see the result, and it really peaks at 2 weeks, so you don't see it immediately. And, they are injections, so, we usually ask patients to go home and use a little bit of ice if they can for fillers, not so much for Botox. And there is some risk of, redness, swelling, and or bruising. We do ask patients to come off blood thinners if they're able to. You can treat patients on blood thinners. They just have a slightly greater risk of bruising. So we do a number of things to try to prevent that. But, if you happen to bruise, you can put makeup on the next day to hide it. So you're right. There really isn't any downtime, but there is some risk of redness, swelling, or bruising with the treatment, and obviously we do everything we can to prevent that.
Did you mention Sculptra? We have still a little time. You want to?
Yeah. So we didn't mention Sculptra. So there's a couple other things that fit in this category that we wanted to talk about that are hot topics. Sculptra being one. So we recognize we lose volume with age. So restoring volume works great, and that can be traditional fillers, or it can be a product called Sculptra, which actually is a biostimulator. It's a protein that stimulates collagen production, and that collagen will build up in the tissues and last a couple of years. So That's a very popular treatment in our office. You get a series of 3 treatments, one a month for 3 months. This is just an injection of really a lot of saline with a little bit of this protein called Sculptra in it. And then that protein will stimulate your body to build collagen. So it's a gradual building of collagen. And it works best for large volume areas like the cheeks and temples and jawline. Okay. So we kind of use that like we use fat in surgery. You know, when I do fat augmentation, I will do the entire face with fat. We, any of the hollow areas. I had a very hollow woman just the other day. We did 70 cc's of fat, which I think is a new record for us at one time. Wow,
that's a lot. Yeah,
that's a lot. But she needed it. She needed more than that. But there's a limit to how much you can do in one day. Just because if you start layering transplanted fat on top of itself, it's not going to work very well. So you can get, that's about the max for a full face. But you think of that relative to fillers, where you might do 2 cc's or 4 cc's of filler.
Yeah.
I mean, you're doing, 10 times as much in a single setting, and it's living tissue, so it's, going to last a long time. Sculptra is sort of the non-surgical alternative. If somebody's very hollow and needs a lot of volume, it's hard to get there with just using fillers. You're not going to do 50 cc's of fillers. Maybe over the course of somebody's life or 10 years, you might do that many, but never, you're not going to do that all at once.
Right.
So Sculptra allows us to build up some of that volume kind of globally and give them sort of that diffuse filling and lifting. And we also find with Sculptra, because it builds your own collagen, it is a little tighter and firmer than a filler, which is sort of gel-like and soft. And so Sculptra has this tightening effect that's very nice and patients really like. So it does give you some lifting and tightening. And in reality, a lot of patients who have Sculptra will have fillers too, because there's certain things we can't do with Sculptra. Right. You can't do under the eyes or the lips or some of these really delicate areas. So often patients with Sculptra will use that for the volume in the big areas, and we'll use fillers for the delicate areas.
Okay. Yeah. Quickly before we take a break, wanted to bring up Instalift as well. You mentioned that in the beginning, and that's kind of it lifts. Instalift is what we call suture lifting, or thread lifting is a older term, but people kind of can relate to that. These are techniques that have come and gone over the years as products have been available. The contour thread lift was very popular. I did a whole lot of them a number of years ago, and they worked really nicely, but those threads were permanent, and sometimes people could feel them. It could cause a little itching or irritation, or occasionally, they could just feel it with cleansing. And anyway, those ended up being pulled off the market. We had no serious problems with them, but I think there were some minor things, and the makers of the thread decided they just would, prefer to pull it off the market. But the Instalift has eliminated those problems. It's made of a material that's absorbable, so you don't have to worry about it, feeling it or having it create any problems down the road, because it's going to disappear in about 6 months to a year. But as it disappears, it's made of a polymer similar to Sculptra, so it's going to create collagen. So you get this lifting effect. It's basically a suture that has little bells on it, so you can use it to tighten and lift tissue. And then as it dissolves, it's going to build some collagen that adds volume and supports those tissues as well. So you can get lifting of the cheeks, jowls, neck, and we've been doing brows lately, and I'm really excited about this because there's a really clever technique where you can use this to lift your eyebrows in shape, and it's really nice for somebody who just needs a little bit of a lateral brow lift, and you just do it right in the office. It takes less than an hour, and you can get a nice lift. So I'm very excited about that. I mean, I love doing endoscopic brow lifts, but if, let's say somebody's already had a brow lift and they just notice that the lateral brows are just starting to sag a little bit, which is where it sags the fastest, is the lateral brow. You can now tuck those up really easily right in the office. Since you mentioned endoscopic brow lift, let's talk about that when we come back. Let's take a quick break. You're listening to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. Welcome back to Look and Feel Your Best with Dr. Patrick Flaharty. I'm Gina Birch. This morning we're talking about the pyramid of rejuvenation, and the base of that pyramid, and this is for facial rejuvenation, is the skin care and the non-invasive things that we can do. We just talked about the minimally invasive things that include injections like Botox and fillers, and now we're going what I like to call the Mac Daddy, and you call the gold standard when it comes to a facial rejuvenation, and that is surgical procedures. And I know that's where your heart and passions lie in doing these things. Yeah.
Well, I do love the non-invasive. Certainly the injectables are fun, and I spend a lot of time in clinic doing, fillers and Botox, which is really fun. But yeah, surgery is sort of my ultimate passion. And, the three-dimensional rejuvenation, which we've talked about on this show before, is really sort of the key. As things have evolved, even over the last 20 years during my career, what we're able to do now is remarkably more advanced than what it was 20 years ago. And the way I think about it, because there's so much more we can do non-surgically, that it's great for people to get involved with skin care, maybe even in their 30s, certainly by their 40s, they should be. Minimally invasive procedures, Botox fillers, 30s, 40s, and carry those things along and do the best you can to maintain it. But there's certain things that we can really only fix through surgery: heavy eyelids, heavy brows, jowling, laxity of the neck. And often when people are ready for that, they might see loose skin in the mirror or heavy eyelids. Those are often things that bring people in. When you look at one area, often the other areas of the face are, have aged similarly. Yeah. They may be less of a touch point for you, but it's still there. And so when we look at patients, we do a very comprehensive evaluation. We look at the skin, the bone structure, the position of the brow, lids, face, neck, and the volume of the face, which, as we mentioned, is really important. And so, a typical kind of a rejuvenation procedure nowadays, a three-dimensional rejuvenation procedure, may entail endoscopic brow lifting, which is minimal incision, no skin removed, just small access points in the hairline to lift and shape the forehead. Eyelids, which could be, some skin removed from the upper lid, perhaps a little fat sculpting in the lower lid if there's bags there. Or sometimes we just use fillers in the lower lid because fillers or volume is more important, or fat. And then lower face and neck rejuvenation, which could entail delicate liposuction to reshape the lower face and neck, improving the jawline, and face and neck lifting to get rid of the looseness and laxity. And then the two other elements that we now can combine with that, which really have made a huge difference, are one, fat augmentation, using your own natural fat. So we harvest the fat with liposuction. I spin it down in a centrifuge, and we layer that fat into the face to replace the volume. So it's like a filler, but it's your fat, that rather than a filler. And when people ask what's the best filler, I always say, well, your own natural fat is the best because it's your own natural living tissue. And for the most part, you're replacing like with like. You've lost. Makes sense. You've lost fat. We're replacing fat back in. Now, other things do happen. The bones remodel and the muscles change. So it's not all just fat that you're losing. You're losing volume in other ways. But most of it is fat. And so when you replace that fat, it gives patients a softer, more youthful appearance. And I have patients bring in a photo they really like, which typically is a graduation photo from college or high school, or a wedding photo, and we use that as the template when we restore that lost volume, which I love to do because it really is a true rejuvenation. You're creating that more youthful volume. And then the last piece of the puzzle would be fractional laser resurfacing, which is a gentler way to rejuvenate the skin. It's still ablative laser resurfacing. It's still tightening the skin and eliminating wrinkles, but it's not as aggressive as fully ablative. It allows us to get, a great degree of tightening, getting rid of sun-damaged skin, brown spots, and wrinkles, but with less downtime. People generally heal in about 7 to 10 days with this type of laser, and get 80 to 90% of the results with fully ablative, with less downtime, less redness. So I've really liked that. It's hit a sweet spot with the laser, and because it is gentler and less invasive, you can do it with facelifts and other procedures. And so, if you look at lifting in the past, it might be things like a brow lift or eyelids or face and neck neck lift, you're tightening and lifting, you're making the patient look better, but you haven't addressed their lost volume, so they still look hollow, and you haven't addressed their sun-damaged skin, so they have hollow, wrinkled skin, but better shape to the face. Now we're taking it to 2 steps further. We're giving them good shape by tightening and lifting, good volume by adding fat back and filling, giving them that youthful shape to the face, and tightening the skin, which gives them a smoothing effect. And when we add these elements together, it's unbelievable.
Amazing.
I mean, it can be really, really remarkable. For the best candidates, it's like really turning back the hands of time, and in a natural way. They look really good. And that's one of the keys to fat augmentation and laser. They make you look naturally a lot better, because fat gives you that more youthful shape that's very soft and natural looking. And so you're not just tightening loose skin over bone. You've got that nice layer of fat, which really makes us look young. And laser takes away all the lines and creases that can, again, make us look older, and gives us that smooth surface that looks so good.
And also, when you piggyback those two specifically, since that's what we're talking about right now, is that fat, when you spin it down, it changes a lot. I mean, it's still fat, but there's some growth hormones or some growth factors or something in there that helps the skin heal better. That's been partially ablated. Right.
Yeah. So the growth factors, when there's some magic to fat, and fat has a high concentration of stem cells and growth factors. And when you spin it in a centrifuge, those get concentrated on the bottom plug of the fat. So that bottom plug of fat is the most potent, and we use that for the most challenging areas, like the lower eyelid, where it's very delicate, and it's challenging to get the fat to stay in the right proportions. With fat augmentation, you usually end up a little undercorrected, but that's actually good, because it makes patients look better but not different.
Right.
It's very natural. You certainly don't want to overcorrect patients, and a mild undercorrection is really kind of the sweet spot. It makes them look younger, healthier, softer, but nobody really knows that they've had something done. It's very subtle. So that's good. And, I think adding all these elements together is really powerful. Patients get the best result. And the downtime is the same. I mean, when you do somebody's eyelids, they can have some swelling and discoloration for a couple of weeks. If you do everything we talked about, it's still 2 weeks, and patients are back out and about by 2 weeks. So, it saves people time and saves people money. Now, obviously, when we evaluate patients, it's very individualized. Not everybody needs a brow lift. Not everybody needs laser resurfacing. Not everybody needs fat augmentation. But those are the main elements that we combine based on what the patient's needs are. But they can all be done together, and that's the power of the modern approach to rejuvenation.
And it's so different from the way things were in the past, because the techniques have changed. If you would do the upper face or lower face in the past, it would take a lot of time to do, and the down, and so that's why people would sometimes piecemeal or put it together here and there. Their facelifts, right?
Yeah, I mean, anesthesia techniques weren't as good. Surgical techniques weren't as good. Our understanding of anatomy wasn't as good. There was, surgery was more invasive, like open brow lifts versus endoscopic brow lifts. Endoscopic brow lifts can be done in about 30 minutes. Open brow lifts took minimum of an hour, sometimes longer, because there was large incisions and more healing time. Modern anesthesia techniques, what we call tumescent anesthesia, where we use low concentrations of local that are infused into the tissues in advance, which really reduces bleeding very significantly, has really reduced the risk of swelling and bruising. I don't even use drains with any face procedures because we don't need them with the modern anesthesia. You just don't get the bleeding, and that's nice. And so people look better quicker. No drains. We do everything under IV sedation. You don't need general anesthesia, which is great because you're doing kind of a series of procedures, and we numb the tissues as we go, so patients are comfortable, don't need heavy sedation, certainly don't need general anesthesia. So there's many, many advances both in anesthesia and surgical techniques that help people. The surgeries are quicker and downtime is less, recovery is quicker.
And then something that you had touched on, you talked about the 3D, where we do the three-dimensional, including the fat, but it's also harmonious, and that goes back to the fact that you can do the upper and lower and everything at once, and not do just one or the other. Because if you do just one part of the face, if you just do your eyes, then you're, like you said, you're going to say, "Oh my gosh, look at my jowls," or "Look at this," and I never noticed that
That's
before.
right, and that's critically important. And so, we always look at the entire face, because somebody might be really focused on their neck. And if we do a lower face and neck lift, we make that lower half of the face look great. But if they have moderately heavy eyelids and brows, then the upper part of the face is going to look real tired and heavy compared to the lower. And there's a disconnect there, and that's what we call non-harmonious rejuvenation. So we always want to be harmonious in the sense that everything blends together. So, obviously we will bring that up to patients and discuss it and talk about it, because you don't want them saying, and this was common in the past where we would do more, do maybe the upper face, brows and lids, and then, 6 months later they come in and go, you know what, I really need to get my neck done, because now that's like,
that's all I see.
That's all I see, right? And we give the analogy of redecorating a room and leaving an old chair. That's what you see every time you walk into the room. And the face is the same way. You always see what's left.
Yeah.
And so if you don't leave anything left, then you look really good, and that's sort of always the goal for me. And so again, with these modern techniques, we can do everything at once. It's a quicker procedure, less downtime, and when you're done, you look great. And the level of patient satisfaction is just so much higher. They have one surgery, one recovery, everything looks great. And really from that point forward, for most of these patients, it's just simple things like skin care, maybe a little bit of Botox or filler once or twice a year, just maintenance things, maybe a BBL to keep those brown spots away. So, from that point on, it may just be complete non-surgical, no downtime office procedures to keep it looking good.
Because we continue to age. I mean, that's not going to stop, regardless of what we have done.
Right.
Well, if you want more information about any of the things we've talked about here on the show, you can go to azulbeauty.com. That's AZUL, azulbeauty.com. Or you know what, just give them a call on Monday, 239-415-7576, 415-7576, and you can set up a consultation and come in and see what Dr. Flaharty and the other ladies here think that would be best for your skin and for what your goals and what you want.
Great idea, Gina.
I thought you'd agree with that. Okay, we're going to be back next week with more of Look and Feel Your Best. Thanks for joining us. For Dr. Patrick Flaharty, I'm Gina Birch.